Dr. Trattler, thank you so much for meeting with us at the ASCRS 2017 meeting. You had a presentation about IOL selection in settings of concurrent corneal disease. Can you outline some of those cases you talked about?
Of course. I'm here at the Corneal Society Day. It's Cornea Day at ASCRS 2017. And my talk was on selecting patients who are good candidates for premium IOLs, which includes toric lenses as well as presbyopic lenses, in patients with corneal conditions such as keratoconus, maybe patients with pterygiums, Fuchs corneal dystrophy, Saltzman's, epithelial basement membrane dystrophy, and even dry eye. And so my talk was basically informing the audience like how we can evaluate these patients and figure out can they be a candidate or maybe not a candidate for these special lenses. In particular, I point out that the key is the initial consultation where we evaluate the patient and try to determine is their cornea normal or abnormal. And if it's normal, then we could proceed to potentially offer them a premium lens. But if it's abnormal, we need to figure out what the abnormality is and whether we can rehabilitate the cornea to make them a candidate.
Sure. So what were some of the specific findings you found for some cases that are not good for certain lenses?
Right. Absolutely. So one common condition that we see is keratoconus. So keratoconus is a condition where the cornea is steep, and sometimes we can't figure out the axis of the astigmatism. And while some doctors may recommend using a toric lens, it really depends on the corneal topography and corneal shape and whether we can identify the actual axis of astigmatism. So we really feel comfortable using an astigmatism correcting lens like a toric lens in patients with keratoconus that I can identify the astigmatism axis, and it's kind of reproducible with the biometry and the topography and everything lines up. But if we can't, then I recommend avoiding the toric lens.
Anything else you would recommend kind of as a take-home message for clinicians when they're looking at IOL selections?
Of course. Well, there's so many other conditions. There's epithelial basement membrane dystrophy where you can do superficial keratectomy and smooth out the corneal surface, and they can potentially be a candidate for either a presbyopic lens or a toric lens. There's also patients that have pterygia, and pterygia can be extending onto the cornea causing irregular astigmatism, but if you perform the pterygium surgery, you can get the cornea normalized, and again, they can become candidates. Also, conditions like Saltzman's nodular degeneration, you can clean up the cornea again with a removal of that condition, and then patients can become candidates.